Hi, I'm Dr. Athre with Athre Facial Plastics in Houston, Texas. The focus of the following video is going to be lip augmentation with filler. So there's a lot of buzz about using filler for lip augmentation. So this is a quick video that has been put together to kind of give the viewer kind of what happens during a lip augmentation procedure, as well as give the viewer a little bit of insight to whether or not they may be a candidate for lip filler. So the first part of a lip filler procedure starts with the consultation. We get the basic information from the patient with respect to what it is that they are desiring, as well as what the goals are. The next thing, from a physical exam standpoint, I really want to see that the patient has some degree of a lip with respect to form. If a patient has super thin lips with almost no red show, they kind of become a poor lip filler candidate because you cannot roll the lip out enough to really give the person a natural appearing lip. Most of these patients, if you add filler to them, are just going to get a little bit of a ducky or projected lip rather than the red show. Once we've gone through all of this, then the next section is to really consent the patient and make a judgment with respect to what type of filler agent we're going to use. Some of my favorite filler agents to use in the lip are plain Restylane or Juvederm Ultra Plus. Once these decisions have been made, the next order of business is to anesthetize the patient. My preference is to do dental blocks for the patient. I like to do V2 nerve blocks, V3 nerve blocks, and a columellar nerve block. With these blocks, the patient basically feels absolutely nothing during the lip filler procedure. Advantage of this is that the surgeon can take their time without worrying that they are hurting the patient. So it just makes it a lot easier for all parties. Once that's done, one of the things that I love to do is to really line the lip. So when you look at the natural lip, you have the skin, you have the red part of the lip, and there's a little bounce right between that intersection. I like to line that with a little bit of filler just to add a little bit of demarcation and definition to the shape of the lip. That is normally done with a sharp needle, and that is shown in the video. Following this, I like to add the volume to the body of the lip. Most of the time, I like to use a cannula. A cannula is like a straw, except it has a blunt tip to it, so that when the cannula passes through the tissues, it tries to find little holes in areas where it can gently pass through the tissues rather than tearing through the tissues. This gives the patient less discomfort, less bruising, less swelling, and a quicker recovery. Furthermore, it's a lot safer because you're not going to penetrate any blood vessels. Most of the time, the straw is going to bounce around blood vessels rather than tearing it with a sharp point. These are some of the reasons for using a cannula. Once the cannula is put on the filler, it's really the artistry of the surgeon to look at what the natural form of the lip is and augment the natural form of the lip.
Okay, ¿lista? ¿Qué quieres? ¿Sí? ¿Te gustas? Okay.
So once all of this is done, I like to rinse the area off and just put a little bit of antibiotic ointment on the lips. The whole procedure normally takes under 20 minutes. If you have any questions about this procedure or any of the other procedures on our YouTube channel, give us a call, 281-557-3223, and please hit the subscribe button here on our YouTube channel. Thanks for watching.